Let's listen to the next murmur, recorded at the fourth left intercostal space. This systolic murmur, which radiates widely across the precordium, is typical of hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is the most common genetic cardiac disease in the United States, with an incidence of 1 in 500 adults. This systolic murmur is actually a summation of two murmurs, an ejection murmur secondary to muscular obstruction of the left ventricular outflow tract, and a regurgitation murmur due to systolic anterior motion of the mitral valve. The ejection murmur is more noticeable at the left sternal border, while the regurgitation murmur is more pronounced at the apex. A loud fourth heart sound is common as well. Listen once again to the murmur of hypertrophic cardiomyopathy. I will start with normal heart sounds, and then add the fourth heart sound, and finally the systolic murmur. The ejection murmur of hypertrophic cardiomyopathy is unique in its response to changes in left ventricular volume. On standing, there is decreased preload and decreased left ventricular volume, which increases the obstruction across the left ventricular outflow tract, thus causing the murmur to increase. Prompt squatting, on the other hand, produces an increase in afterload, which increases left ventricular volume and decreases the obstruction, with a corresponding decrease in the murmur. Notice the change in the murmur of hypertrophic cardiomyopathy with a squat maneuver. I will begin with the standing position. Squatting. Standing. This change in the systolic murmur of hypertrophic cardiomyopathy in response to squatting is the opposite of the change of purely valvular mitral regurgitation to this maneuver. With the increase in afterload brought on by squatting, the murmur of mitral regurgitation increases. Listen to the change in a mitral regurgitation murmur with squatting. I will begin with the standing position. Squatting. Standing. Earlier estimates of the annual mortality for patients with hypertrophic cardiomyopathy were as high as 6% per year. However, recent population-based studies have demonstrated no significant decrease in life expectancy for cohorts of patients with hypertrophic cardiomyopathy compared to the general population. The previously reported higher mortalities were most likely due to referral bias. The majority of patients with this disease are asymptomatic. When symptoms occur, they are most likely to be due to heart failure. Listen once more to the murmur of hypertrophic cardiomyopathy. I will start with normal heart sounds, and then add a fourth heart sound, and then the murmur. Despite the overall benign prognosis for patients with hypertrophic cardiomyopathy, there are subgroups that significantly increase risk of sudden death. In fact, hypertrophic cardiomyopathy is the most common cause of sudden cardiac death in young athletes. Factors that increase the risk for sudden death include left ventricular wall thickness greater than 30 millimeters and an outflow tract gradient greater than 30 millimeters mercury. Notice the change in the murmur of hypertrophic cardiomyopathy with a squat maneuver. I will begin with the standing position. Squatting. Standing. When needed, there are a variety of treatments available for patients with hypertrophic cardiomyopathy, including pharmacologic treatment, as well as surgical myectomy or alcohol ablation of the ventricular septum for patients with symptoms due to excessive obstruction. Each of these therapies has a role, and more than one therapy may be required in some patients. In summary, hypertrophic cardiomyopathy is the most common genetic cardiac disease in the United States. Most patients have no symptoms and a normal life expectancy. The murmur of hypertrophic cardiomyopathy becomes louder with maneuvers that decrease left ventricular volume, such as standing, and softens with maneuvers that increase left ventricular volume, like squatting. Patients with massive left ventricular hypertrophy are at increased risk for sudden cardiac death. Surgical myectomy, as well as alcohol ablation of the ventricular septum, are useful for patients with symptoms due to excessive obstruction. Listen once again to the murmur of hypertrophic cardiomyopathy.